Hello everyone. In this presentation, I will be talking about how the skin microbiome, the community of microorganisms living on our skin, is connected to psoriasis, a common inflammatory skin disease. Psoriasis and the skin microbiome, understanding how tiny organisms influence skin health. What is psoriasis? Psoriasis is an inflammatory skin disease that impacts 1 to 3% of the world's population. The immune system mistakenly attacks healthy skin cells, causing them to multiply very rapidly. There is no cure, but there are treatments. Plaque psoriasis is the most common. Signs and symptoms may include red patches of skin, itching and burning soreness, dry, cracked skin that may bleed, most commonly found on elbows, knees, and the scalp. Role of diet and lifestyle. A healthy and anti-inflammatory may help manage inflammation and flare-ups on the skin microbiome. Anti-inflammatory diet includes Mediterranean-style diet. This diet is rich in a range of anti-inflammatory substances such as antioxidants and unsaturated fats, such as fruits, vegetables, fish, olive oil, and grains. Extra virgin olive oil helps reduce coronary heart disease risk and modification of the immune and inflammatory response. Probiotic foods such as yogurts and fermented foods may help balance microbiota. Foods to avoid can be processed foods, dairy products, gluten, alcohol, processed meats, fried foods, and very sugary beverages. Epidemiology of disease. Psoriasis affects both male and females with earlier onset in females and those with family history. Symptoms can appear at any age, but the majority of most cases, approximately 75%, present before the age of 40, with a peak at 20 to 30 years old. Psoriasis is an autoimmune cause that attacks healthy skin cells, causing overproduction, and it is not contagious. Triggers can include infections, especially streptococcus throat infections, stress, cold weather, skin injury, and certain medications. Skin microbiome. The most common skin microbiota contains Staphylococcus, can cause many forms of infections involving skin and soft tissues. As aureus continues to be an important pathogen in the community and in hospitals, causing high morbidity and mortality. Propionium bacterium is considered to live on the skin and contributes to health by producing propionic acid, which helps maintain an acidic pH that inhibits the growth of pathogens. P. acnes is associated with the development of acne vulgaris. How it was tested? Healthy individuals with no psoriasis and individuals diagnosed with psoriasis. Mechanisms of psoriasis. Psoriasis results from a type of problem with the blood cells in the immune system called a T cell. In psoriasis, T cells attack healthy skin cells and trigger an immune response where blood vessels in the skin get larger. Keratinocytes reproduce and mature much faster than normal, and new skin cells form and move to the surface too quickly. Quickly, they build up as thick, scaly patches on the skin surface that characterize psoriasis. So, immune cells lead to cytokines, which leads to fast skin growth, which leads to psoriasis. In conclusion, the skin microbiome is closely associated with the functions of the skin barrier and immune system. Advances in sequencing technology have allowed us to characterize the skin microbiome and how it is altered in psoriasis. Studies and future research. Previous studies show that skin microbiota is involved in the balance of cutaneous inflammation and anti-inflammatory processes. Also, with roughly 2% of the population affected, psoriasis is a public health burden worldwide since there is no cure. Future research will focus on the use of data to stratify patients and guide therapy. Improved access to care and early intervention with systemic therapy are concepts which are being discussed increasingly. This is where service development overlaps with research, calling for innovative approaches and research methods to achieve this goal. Thank you for learning about psoriasis with me.